Approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business, A, County Clerk number 1, consider all voucher payments.
There's no vouchers. We were off on Friday.
There's no vouchers.
Okay,
You're right.
next item.
Item A2, consider correction orders.
I would move that we approve all correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item B, Extension Council number 1, final Extension Council's 2021 budget.
Good morning, Commissioners. Cindy Evans, Director with Shawnee County Extension. Extension Council law requires that I file with you by July 15th each year our budget, and it was submitted to Betty May 15th. So unlike every other year in the past where I say it's the dance and I give it to you and you have to reject it and go back and forth, because in years past it needed to be approved usually in July. And several years ago, the commissioners started to just consider it in August with all the other budgets, and that is acceptable, to K-State as well. So all I am doing today is filing it, and you just have to acknowledge receipt. And then we'll just be considered in August as you consider all the rest.
I'll move to acknowledge receipt of the Extension Council's budget.
I will second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Cindy. Next item.
Item C, County Councilor number 1, consider approval of resolution number 2020-42, the Shawnee County Coronavirus Relief Fund.
Good morning, Betty Griner, Director of Administrative Services. Joni's not able to be here with us this morning, so I am going to handle these two next items that relate to our CRF funds. The first one is, as Cindy just read, it's a resolution that we have to sign and send to the state. It's our agreement with the state to receive these funds. Our county is receiving $36,763,813. And this agreement is the agreement between us and the state that lays out their responsibility, our responsibility, mostly our responsibility. But so I'll go over this briefly. The first page of this resolution, the whereases, is just really giving a history of what brought us up to this point. The the different dates that the different items happened. The next page, on page 2, starting on section 1, is where it really gets into the responsibility of this. It just provides that they must be, it must be spent for eligible purposes. It lays out the 3 eligible purposes that are necessary expenditures incurred due to the public health emergency. It has to be items not accounted for in the budget most recently approved. And then they must be costs incurred between March 1st and December 30 of 2020. The next section, section 2, just gives you examples of acceptable expenditures. Section 3 gives you examples of expenditures that are not allowed. Section 4 states that it may not be used to directly account for revenue shortfalls. So, you cannot ask for reimbursement of revenue shortfalls. Section 5 goes into the different dates. The first date, August 15th, is a very important date because that is the first reconciliation of the funds. Now, that is the first time that you can get reimbursements for costs that have already been spent, but it's also the date that we have to send them a plan for the direct aid, which is for all the other expenses that we plan on spending through December 30. That's not only for the county, that's for all of the other entities included. And if that total of that plan that we send to the state, if it does not total up to our total amount of our funds, then they will pull the difference of those funds back to the state. So that is a very important date. That is the date that we are racing towards right now. So that date is the first date on there, and then September 15th is just the next reconciliation date for reimbursements. The same with November 1st and December 1st. Those are dates that we would send a reconciliation to the state of all those costs that have been reconciled. February 1st is the last date for the final reconciliation to the state. All of the items have to have been spent by December 30, but the state is giving us time just for the accounting to get it all pulled together and send them the final reconciliation. And anything that is not spent has to go back to the state. Then Section 6 just goes over how all of this must be made public. The public must have access to all of this. All of our Spark committee meetings we are doing by Zoom. Those are being recorded, and those will be made available to the public. Any of the reporting that we have between the state will be made public. Basically, everything connected to this will be made public. It'll be made available to the public. Section 7 directs the county to allocate and share the CRF funding to public educational and municipal entities within the county. So this is where we are agreeing that we will share this money with other taxing authorities, school districts, cities, that type of entities. And it also states here, just for informational purposes, if a public educational or municipal entity has locations in more than one county, and we certainly have school districts that, are in more than one county, the entity shall be treated as located in the county in which the entity's principal office or headquarters is located. So that's mostly going to apply to school districts, that if your headquarters is outside of Shawnee County, then you would request your funds from the county that your headquarters is in. Then Section 8 just recognizes that COVID-19 pandemic has disproportionately impacted racial minorities within the state of Kansas. And it asks that, and we are stating that Shawnee County will consider and incorporate efforts to address such disproportionate impacts on racial minorities in its direct aid plan. That direct aid plan is, like I told you, what we plan on spending these monies for throughout the end of the year. And we just have to have taken that into consideration and have that in a narrative type form how we took that into consideration. And then Section 9 talks about how the Inspector General of the Department of Treasury determines if the payments are eligible and if they've been used for eligible purposes. If they deem anything to be ineligible, then it's a debt owed to the government, and we are agreeing to cooperate with all audits and inquiries, and we agree to pay any in debt that for any of those that they say are ineligible expenses. Now, what the Spark Committee has talked about in our plan is that any taxing authority that we are going to give money to would also have to sign a similar resolution with us, that they would be financially responsible for any of their funds that are deemed ineligible. And then the last section is that the United States Department of Treasury or the Governor's Office of Recovery may issue guidance in the future. So that is the resolution. The Sparks Committee is asking for your consideration and approval of this resolution. It must be signed and supplied to the state by July 13th in order for us to receive the funds on July 15th.
Any questions?
Just a couple. Betty, just to clarify on the school part, just to make sure that I'm clear, Rossville has students that live both in Shawnee County as well as Wabunsee or Pottawatomie County. since the school is located in Shawnee County, Rossville would not be able to apply from Pottawatomie or Wabunsee County. They would only be able to apply to Shawnee County since the school is located in Shawnee County.
It's where the headquarters is located.
That's-
The
so that's
headquarters of the
correct.
school district.
Okay.
Now, they also clarified a little bit that if it's in 3 counties and the 3 counties want to work together and allocate funds, if each of the 3 counties want to do that, they can. But the primary county you would look to is the one where the headquarters is located.
And Rossville is really about the only school. I mean, I think most of our kids that go to Washburn Rural live in Shawnee County. Very few would come from Osage County. Shawnee Heights, there may be some that live in Douglas County, but very few
Right.
are going to be in Douglas County. But I could see where Rossville may be an issue where we would have some overlap with those 2 adjoining counties.
Well, and I think it's a really good item that they put in this resolution, because otherwise, it does give a lot of clarity, because otherwise you could have some, real difficulties in trying to distribute those funds to the school districts.
The secondary question I had, given our tight timelines that we have in administering these funds, what are we doing to get word out to all the different entities, which may be our taxing entities as well as the hospitals or other
Yes.
organizations?
We have discussed that in the Spark Committee meetings, and 2 emails have gone out to those taxing authorities. One was just this last week, and then there was one the week before that, to all the taxing authorities, giving them information. The first one was just telling them to start thinking about it. The last one was sending them the guidance we have and letting them know time frames and things like that we are supposed to get more guidance from the state this week, and that we will be forwarding that out. So we have reached out to all of them twice now to make sure that they are aware and to get started with the process.
Okay. Thank you.
Betty, with these short timelines, I know that it seems like a lot of this is looking back at expenses that are already incurred, but with our numbers going up as they are, I mean, it's safe to assume that the bulk of our expenses are still forthcoming. So is that a concern, or can we try and predict future expenses?
Yes.
Well, that is the plan. That is
Okay.
what we have to do. I really believe the expenses that have been incurred to date are the smaller piece of this. The larger piece of it will be the costs that are incurred between now and the end of the year. And in fact, we're encouraging all of the entities, including Shawnee County, to think big, look outside the box. What can benefit us now for COVID-19, but that can also benefit us in the future? So that's why this direct aid plan is so important.
Okay. Any other questions?
I'd move to approve.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Betty. Next item.
Item C2, consider authorization and execution of contract C249-2020 and emergency purchasing agreement to hire Witt O'Brien's LLC as a consultant for Shawnee County in regards to the receipt, assessment, and distribution of coronavirus relief funds.
Good morning, Betty Griner, Director of Administrative Services. You will remember back on June 25th, we came to you and asked you for a waiver to the purchasing policy for the formal RFP process to look for a consultant that can help us with the distribution of this coronavirus relief funds. And we interviewed 2 very capable consulting groups. The subcommittee and the Spark Committee both is recommending this company in particular, Witt O'Brien's. They have already contracted with several of the counties in Kansas, so they are familiar with Kansas and they're in the governor's program that she has put together, the Governor's Spark Task Force. They have already been working with them and with the Governor's Office of Recovery, who is administering the just the paperwork and all of this on that. They have already started on this and have a lot of the forms, the templates, the matrix all already set up. They will not only help us with getting together this direct aid plan that I talked about, they will also help us, they have some matrix set up about what expenses are considered eligible expenses and what would knock that out of being eligible. They have, they will help us with the reconciliations. They will help us with bringing the requests from all the different counties in and trying to consider those. So this, I think this, the first order of business that this will help us, it will help us meet that August 15th goal, because that was a very big one. Anything we cannot account for in that August 15th plan has to go back to the state, and our county does not get to keep it. So the Spark Committee is recommending that you approve this agreement. It is for 180 days, so 6 months, so it will cover, you know, pretty much till the end of the year, and all of the, everything has to be spent by December 30. The amount is, shall not exceed the ceiling price of $150,000. This is an eligible expense, and that has been verified with the state, the Governor's Office of Recovery, that this, and in fact, they are encouraging counties to either go with a consultant or to hire additional staff to handle this. So, try to answer any questions.
Betty, given that we're looking at a maximum price of $150,000 and it being an emergency contract with an out-of-state firm, I know that we're always asked what steps did we do to try to see if we could hire local or hire within the state of Kansas, and are you sure, are you recommending that this is the most qualified, best person to go with?
Yes, we looked for all firms that are offering this service. It's kind of a specialized thing, and they had to ramp up very quickly. We only found 2 that we felt were really qualified to do this and are offering this service. We tried to look, we also talked to other counties. We, tried to look at as much as we could, and we only came up with 2 qualified candidates.
Betty, this $150,000, is this eligible expense for the CARES?
Yes, it is.
Good. Commissioner Mays, do you have any questions?
I'll move to approve.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Betty.
Thank you.
Next.
Item D, Human Resources. Number 1, consider approval of request to fill a newly created Public Information Officer position with a minimum annual salary range, including benefits of $78,887.44, with Amanda Mulholland to assume the position on July 13, 2020, with funding from the commission budget.
Good morning, Commissioners. Angela Lewis with Human Resources. I would just like to note that with this Public Information Officer, we have made some changes to the position from what was originally advertised. We've added some supervisory responsibilities, and this is a promotion for Ms. Mulholland as well. And our HR policies allow us to put someone on a step from where they came from or in somewhere where their salary would be increased, and that's what's happened with this particular position. Ms. Mulholland is here today, if you'd like to introduce her.
Sure.
Hi, Commissioners. How are you?
Very good.
Do you want me to introduce myself?
Sure.
Okay. My name is Amanda Mulholland, and I am currently the Deputy Public Information Officer, Health Promotion Coordinator for the Health Department, and I'm looking forward to filling the role as the Public Information Officer for the Board of County Commissioners starting on next Monday, the July 13th.
Next Monday. Thank you very much, and welcome aboard.
Thank you.
Is that a motion to approve?
That is a motion to approve.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item D2, consider approval of request to create and post a media coordinator position with a minimum annual salary range, including benefits of $56,511.80, with funding from the reclassification of an existing position in the IT department.
Good morning, Commissioners. Angela Lewis with Human Resources. We are creating this position that will work with the PIO and again in your office. The funding does come from IT, and we'd like you to approve this position today so we can get moving on a hire.
Any questions?
No, I move for approval.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you,
Thank you.
Angela. Next item.
Item 5, Administrative Communications.
Okay, at this time, we open the podium up to anybody from the public to speak on any subject, or if we have staff members that'd like to make some announcements, communications. Yes.
Hello, my name is Jackie Highland. I'm a physician in the community and the chief medical officer at the University of Kansas Health System, St. Francis campus. I just want to speak on the issue of wearing masks in public places when physical distancing is not able to be maintained. As a measure of what we need to do in the community is looking at hospitalizations. Currently, both hospitals are not overwhelmed with COVID-19 infections, which we've been very fortunate in Kansas to, from natural physical distancing, we have not seen those type of ramifications yet. But we're on that, exponential curve. I think this is a key time to introduce a measure that can prevent an overwhelm within the system. One of the things that we saw as we had to stop elective surgeries because we didn't understand some of the transmission of the virus was a huge economic hit to hospitals across the country. So that is one thing I think would help prevent, because in order as we kind of get up to that edge of being overwhelmed, that our surge capacity lies within our ability to do elective surgeries. So that the normal care that we have to do every day would again have to be postponed for those patients who may have cancer or other illnesses. So in my view as the chief medical officer at St. Francis, and also was lucky enough to be incident commander for our COVID-19 emergency response, is that we want to be able to, just like with the flu, maintain a balance. And I think masking and being able to test, which we're not talking about today, but masks I think will help kind of, just help us maintain, a certain level of infections rather than being on the exponential curve and then possibly overwhelm us. Because what we do today, we won't see for 7 to 14 days, and then we can't stop it, so that's my comment, so.
I have a question. Do you feel like your hospital now is running at a normal capacity?
I would say most things are up to capacity. The emergency room still is not seeing the visits they were before, but our surgeries are back up to where they were before. Outpatient visits, and we're doing a lot of telemedicine visits as well.
Did you see a lag in treatment for people who are just afraid to come in?
Yes, we're still seeing that.
Are these like people avoiding cancer treatments and things like that?
Probably more of the acute services like strokes and chest pain and those kind of things. So I think that they're staying home when they maybe just don't recognize the severity of their symptoms and have been told that they should call before they go or shouldn't, readily access the services. So I think that's part of the delay as well.
Have we had a number of deaths that you can attribute to that?
I can't here in Kansas, we haven't been able to attribute that, but I know in New York City, there was a significant number of people who did not, that they did find in their homes and were related to that. But here, with that significant decrease in visits, I would say that it would be a guess.
How about like child abuse cases? Have you seen where kids have been abused? Have you seen more of that, or is that?
I have heard anecdotal stories of that, but I don't have the data at my fingertips now, but we certainly could, look at that to be able to present to the commissioners if that would be helpful.
Any other questions?
No, other than we had our work session at 8 o'clock and discussed a resolution for Shawnee County And I think that at the appropriate time, there'll be a motion to have us come back at 3 o'clock to look at the adoption of a resolution for Shawnee County.
Okay.
So, but
Thank you.
Thank you.
I appreciate your time.
Thank you, Doctor.
Got on my earring. Betty Griner, Director of Administrative Services. I just wanted to remind the public that budget hearings start today at 10 o'clock. And, well, we really have a full week this week, but they will continue for a couple more weeks after this week. Just wanted to remind the public that they are all streamed live, but they are also recorded, and that anyone can go back and watch them after the fact.
Thank you, Betty.
Thank you.
Anyone else? Commissioner Mays?
Nothing from me.
Commissioner Hood?
I would make a motion to have the county commission return at 3 o'clock this afternoon as part of their regular meeting to consider the adoption of a resolution regarding the wearing of masks in Shawnee County.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed? Yes.
Real quick, is that sufficient, that
We need to
motion? Do we need to
recess.
add it to the agenda also, or would that encompass that?
No, we just need to recess the meeting until 3 o'clock.
So if my motion would have that.
Hold on. Are we going to, are there any, going to do executive session or not?
I don't think there's a need for executive
So that's
session
nothing.
today.
If there's no executive session, then you can, now
Recess.
you can do whatever you want now. As long as you get my agenda done, I don't care what you do now.
Well, I mean, but we would need you back at 3 o'clock, or,
Chris, I think they're talking to you. Oh, okay.
but that, again, that is to have us recess and then resume at 3 o'clock for that one item.
Well, they have to ask for a motion for that.
That's my
They have to
motion.
make a motion for that.
And that is my
That's what
motion.
he's doing.
Yeah, we voted on it, right?
And second?
I thought we already voted,
Yep,
but
and it's
but
been-
He just clarified.
he's clarified.
Okay, just a clarification.
Yep.
Okay, so that
Just
was-
making sure that Ms. Beck gets our notes right. The other item, Commissioner Rippon, I received a mail over the weekend from our elections commissioner, and I really want to, I know this went out to all the registered voters in Shawnee County. If you did receive it, please take the time to read it. It does outline the timelines for registration to vote. It also included an application to vote by mail. I know that there's a lot of concern about voting or going out in public, especially with the COVID crisis that we're in right now. If you have any health concerns, if you don't feel safe going to a public voting booth, please fill out your application to vote by mail. There are timelines on that. There are qualifiers as to when you can or cannot make that application. So make sure you look at it timely so that you can get registered vote by mail if you so choose.
Thank you. Other than that, I attended the fireworks out at Lake Sherwood. It was very nice, well attended. It was a great event. Other than that, I think we're adjourned.
All right?
No, recess.
No, you're in
Recess.
recess.
Recessed, I'm sorry, excuse me. We are recessed. I need a recess.